So, you've decided to sign up for Anatomy and Physiology, and you're probably wondering, what did I get myself into? Well, so my name is Dr. Sean Dougherty. I've been a professor of human anatomy since the late 1900s. The course, as you're probably aware, is going to be one of the more challenging courses that you've ever taken, and you may be a little intimidated, rightfully so. But the thing is, it's not challenging because of the material. It's not like you're doing calculations or whatever. It's not biochem. It's challenging because of the sheer volume of material that you're required to learn. That's the thing. And with that, this isn't a class in which success is based upon who is the smartest versus who is the dumbest. It's not a smart person versus dumb person class at all. Rather, success is based on who has the time for this course. This is not a course that you can wait and put off studying to the last minute. This is a course that needs attention every day, every night for a few hours. And so that's where I usually see people fail. It's not because they're not capable, but rather it's because they don't have the time. Work gets in the way, life gets in the way, all of these different things, or worse, TikTok gets in the way, something like that. And so as you get into this, you have to think about your life and think about what your schedule is like, and do you have time, do you have space for this class to give it the attention that it truly deserves, which honestly is 2, 3, 4, 5 hours a night, really. So that's something to keep in mind. The other thing to keep in mind here too is that you are going to be required to learn a sheer massive amount of material. You're learning the body. But this is essentially learning a language. And so you have to treat it that way as well. Treat it as you would learning French or Spanish or even English, if English is your second language. How do you learn those things? You learn them by practicing them. You learn them by using them. You learn them by putting away the books and the term lists and just trying to use the terminology from your own mind. You're trying to gain fluency. So this is essentially a language, the language of medicine that you are trying to learn. And the tricky part is you got to get fluent by it, and you got to get fluent in it in about 3 months, 4 months, something like that, which can be done. The last thing I'll mention here too, or what you consider, is that though you are going to be learning so much, at its core, anatomy is only asking 3 questions. Anatomy wants to know what it is, it wants to know where it is, and it wants to know what it does. What is it, where is it, what does it do? That's it. And so if you can strip it all down to that, it becomes actually kind of easy to learn, because you're gonna have this notebook that's gonna be about that thick by the time you're done with the class, and you're gonna have these, you're gonna be studying for the exams, and you're gonna look at this sheer wall of all this stuff you have to learn. But take a step back and say, hey, yeah, I got all this stuff, but what is it I'm after? What is it? Where is it? What does it do? That's it. Example, what is it? It's a mitochondria. Where is it? It's in the cytoplasm of a cell. What does it do? It makes ATP. Done. You just learned a mitochondria. And that's kind of what it's all about. So yeah, that's the deal. It doesn't need to be hard. Just give yourself the time. Try and learn, honestly, 5 new things a night. If you can learn 5 new things a night by the time the exam comes, you'll probably be okay. All right? So stay with it. Stay consistent. Show up to class. Don't be late. Don't skip exams. And you'll get through it.